I'm Angee Neish. I'm Director of Rehab at Kansas Joint and Spine Institute. We have 5 surgeons whose patients we see as a rule, and then we get patients from outlying facilities. So most of our patients are post-op spine surgery, joint surgery, or spine injury or joint injury. So our patient population primarily consists of post-op laminectomy, discectomy, or spinal fusion, 360-degree spinal fusion, or artificial disc replacement. A large population of total knee replacements, total hip replacements, hip bursitis, knee pain, and then you get we do both land and pool therapy, and as a rule, all of our patients at some point, unless they're a cervical injury, will get into the pool and quickly graduate to doing land therapy as well. We protect our spine patients much longer, pool only much longer. So we have a few different ways that we address spine injury and spine surgery. So first, spine surgery, status post laminectomy and discectomy. We can be much more aggressive, much quicker, but almost always spine surgery patients will respond better to flexion or bending exercises. So we start them all with very gentle exercises, first aimed at pain control and making sure that we're doing the right things. The first time we'll get the patient in the pool, we'll usually first have them do some gentle forward flexion, either pulling one knee to their chest or sitting on the stairs in the pool and doing gentle forward flexion. As long as that doesn't hurt, then the next visit we'll add a few other things. So post-op spine surgery will initiate flexion exercises. We'll do some gentle hamstring stretches, maybe if the patient tolerates it, and then we'll initiate very gentle gait, usually about 0.5 miles per hour for 5 to 7 minutes that first day. Very slow. And what we always tell the patient is we hope that the first day that they leave and they say, I could have done more, rather than leaving in that night cursing us and wishing they'd have done less. So we slowly build rather than pushing them past that threshold of pain. And that's a spine surgery. Our spine injuries, we follow basically McKenzie protocols or Canadian Back Institute type protocols, where we identify first what their bias is. Do they have a flexion bias indicating that they have spinal stenosis or some degenerative changes in their spine? Or do they have an extension bias that indicates maybe a discogenic type pain? And then we focus their first exercise treatment very similar to the spine surgery. We use the direction that's safe for them. So if it was forward flexion, we'll do the forward flexion sitting on the step, single knee to chest, hamstring stretch, and then walk. And depending on how acute their injury is and how much their pain is, we may allow them to walk a little bit faster, but usually not much longer than 5 to 7 minutes. And then if they're a discogenic back pain, we start with an extension-based program and initiate slow walking as well. We find our spinal stenosis patients that can't walk on land almost at all, because that's what causes the pressure on their nerve roots. They tolerate walking in the pool much better. And there's a really nice carryover to where the more they walk in the pool, the more they tolerate full walking on land. So the first visits, like we talked about, we're very protected, and we identify what makes the patient better and what makes them worse. And we use that in the pool to gain pain control. So with a spine surgery, it's usually forward flexion, and we know that's a safe position for their spine. And then with discogenic back pain, it's usually extension. Once we have identified what controls their pain, and we keep them very controlled, the spine surgeries, we slowly add increased stretching, half quad stretches, and then we'll add strengthening, starting with lower extremity, and then start doing things like pelvic tilt against the wall. And then as they tolerate it and as they go through their protocol, as they get further along in their healing process, we start to add swim fins, aqua socks, things like that for strengthening. Start doing arm weights with dumbbells or with the yellow beveled weights that we use in the pool, and really start focusing on strengthening. And slowly each treatment progression, we usually increase their distance or their length of time on the treadmill and the pace that they're going on the treadmill by about 0.2 miles per hour, 2 minutes a day. And then as they really get to a nice pace, we'll start increasing the jets for resistance as well. So our phases are very clearly pain control first, and spine surgeries often stay in the pool longer because that's where they get their best pain control, and then into flexibility, and then into strengthening activities.
I infused T4 to L2 this surgery. They put the hardware in, the instrumentation in from the back, removed a rib, and then went in through the front from that rib and fused T5 to T12.
So immediately after surgery, a bio-occlusive dressing we had to put around here and straight up and down her spine. So usually the first thing we have a spine patient do when they first get in the pool is to sit on the step and do forward flexion. So this is a safe motion post-op spine because the majority of your flexion is coming from your hips. You're not rounding in your lumbar or your thoracic spine as much, and you're stretching out the paraspinal muscles and the muscles in your low back. And it usually gives back patients some pain control. So we tell them to sit down on the step as far into the water as they can and still keep their head above water as they do the exercise, so they're starting to get some warm water around those muscles. So we usually have them do this at least 4 times for a slow count of 10. Just enough to start to relax those muscles, and never to the point of pain. And we always tell our spine patients if anything we give them begins to increase their pain, to stop doing it immediately. The next thing we'll have her do is stand up and do a gentle hamstring stretch. And this is also something that's pretty safe pretty immediately after surgery, as long as the patient tolerates it and it doesn't cause any increased pain. So this is the same 4 on each leg for the slow count of 10. Then we'll have you lean against the wall, and she'll do a single knee to chest. And this is usually the first exercise that you can start to do on land as well. But the very first treatment, these are really the first 3 that we'll allow a back patient to do. And then we'll walk, would be the first initial visit. And this is to stretch glutes, and then it also stretches your low back and your paraspinal muscles. We could start some strengthening, so we'll do our squats. And we always cue them to sit back, never allowing their knees to come forward past their toes so that they don't cause any injury to their knees, and just to the level of the point of comfort. So it helps warm up some muscles, but it also starts to help do some quad strengthening, and quad strength is very important post-op spine because they can't use their spine. You should never use your spine anyway for brute force and for lifting heavy objects, but if we give them a stronger base to stand on, they're more likely not to accidentally overuse their back later on in life. And both of our spine surgeons here find that one of the most important things is lower extremity strength. Core stability as well, but lower extremity strength is really important. Lean against the wall and do your pelvic tilts. And there's another way, a good way to start some core stabilization in the warmth of the water and the support of the water. Normal pelvic tilts, just gentle pelvic tilts. So you lean against the wall, a little bit of knee bend, and then you contract your abdominal muscles and pull your belly button back towards the wall and tilt your pelvis out. Tighten your glutes as you do it, and you start to gain some lower abdominal strength. So these are alternating lunges, and you get a lot of core strengthening, but you also get full range of motion into both knees, and you get some quad strengthening. We'll use this for at some phase of the protocol for almost all patients. And as you get stronger and you can let go, you do a lot more core stabilization. And you can turn the jets on for this as well, or if somebody else is walking in the pool and has the jets on, it adds a nice challenge to that. We can do swim fins for hip ab and ad, flexion extension. So first, with the way that those are facing right now, she'll do flexion and extension of the hip because it'll resist forwards and backwards movement. The slower you go with hip flexion extension and ab and adduction, the more the buoyancy of water will help. The faster you go, the more resistance you get. And then when you add the swim fins or when you add aqua socks, it gives you even more resistance. And then she'll kick it to the side till she turns it sideways so that now when she goes side to side, she'll resist. And because she's a back patient, she can go all the way into adduction where she crosses midline. But our hip patients can't do that because it violates their hip precaution. So this is a nice one that isolates your hamstring and just knee flexion, knee extension. And this is a nice one to do with total knees as well. And it's a nice one also with total knees to put the aqua socks on because the aqua socks will actually, the buoyancy of it at the end range will actually pull them into more knee flexion, and that's what you're really battling. So you're strengthening into knee flexion and knee extension. But and with those, we work up to doing 2 sets of 20 at a time. And then you can also cue them to get a little bit of hip extension. And you'll be more careful of that with a spine patient because you don't want to get lumbar extension where you put your foot up on the step and lean back and squat, and that's especially with total knees. Just make sure you don't go into any lumbar extension. So then you squat down and go back. So now you're not just getting your quad, you're getting your rectus femoris. Well, you're getting the rectus femoris part of your quad. But it's great to stretch it in the water because it's warm. And then gastroc soleus, so the one with leg totally straight for the slow count of 10, and then one with the knee bent for the slow count of 10, so that you're stretching both the gastrocs and the soleus. Just do hip flexion extension, ab and adduction. So, and that's the nice thing is that Jenny is holding on. But as she gains core strength and stability and lets go, those are great at challenging balance, and they're really great at, especially the older population, helping them gain some increased balance and safety. Like just some resistance options. Or some assistance options, because you can put those below your ankle or below your knee at your ankle and let your foot come up and your knee come up in the knee flexion as well. So with the back surgery, well, we started first on pain control and flexibility type things, and we'll always have to have that as our core, and then we'll do core strengthening, lower extremity strengthening, upper extremity strengthening. If you do both arms at the same time, you really challenge your balance at the same time, and so you can't see it, but Jenny's having to work hard, especially when she'll start to go frontwards and backwards with those. She'll have to work hard to maintain her balance, and her core will just have to work the whole time. All of her accessory muscles will have to work in counterbalancing the force of the water. So we like to keep them just below the plane of the water. So this one, she said she has to stand in a stance. She can't stand squat because it's too challenging for her balance. She doesn't quite have the core stability to hold that. And triceps extension. So the first time Jenny walked after surgery, it would have been very slow. So the spine protocol would be 0.5 or 0.7 miles per hour for 5 to 7 minutes. So the other thing we do is sideways and retro walking. So now take it really slow and just do a really nice slow wide hip ab and ad, yeah. And then turn and go back. And you can use this to work on breaking up some motion with the total knee as well. And then go back to the side and do karaoke or braiding.
March 29th of this year, I had my 4th spine surgery operation for scoliosis. During this surgery, they did a posterior fusion with hardware from T4 to L2 and removed a rib and went in through that area and did an anterior fusion from T5 to T12. And 2 weeks later, they sent me to pool therapy, and it was awesome. I got in the pool. It was the only time I felt pain-free. I think it's such a powerful tool to be able to strengthen and stretch everything. And the hardest part for me was the ribs, because my first surgery they took about an inch out of each rib on the right side, and they were supposed to heal right back together. Well, they healed like this. So they've had to go in twice and remove it felt like a second spine back there. You can see my hardware through my skin. Well, those are all the screws. So that looks like I have 2 spines too, because this is the hardware and then my spine's over here. So.